Have you noticed subtle yet unsettling changes in a loved one over the past year? Many assume that old age takes its toll suddenly, but in reality, the body often whispers its warnings long before the final chapter begins. These signs, small at first, are easy to dismiss as mere aging, but only when it's too late do families look back and realize the clues were there all along. The real tragedy? Lost time that could have been spent preparing, creating lasting memories, and ensuring a peaceful, dignified farewell. In this video, we'll uncover 5 crucial signs that often appear up to a year before an elderly person passes away. Some may be things you've noticed but brushed off as normal aging, while others might be subtle shifts that signal the body's gradual decline. Recognizing these signs early isn't about fearing the inevitable, it's about giving you the chance to provide better care, cherish meaningful moments, and ensure that when the time comes, your loved one's final days are filled with comfort, love, and dignity. Stay with us until the end. These 5 signs could change the way you approach the final chapter of life. When you understand what's happening, you won't be caught off guard. Instead, you'll be prepared to make the most of the time you have left with those who matter most. Now, let's begin. One of the clearest signs that life is entering its final stage is a deep, unshakable fatigue that no amount of rest can fix. This isn't just feeling a little tired after a long day. It's a profound exhaustion that makes even the simplest tasks feel overwhelming. Getting out of bed becomes a struggle. Walking across the room takes noticeable effort. Everyday activities like cooking, dressing, or even holding a conversation start to feel like insurmountable challenges. This isn't just a natural part of aging, it's a sign that the body is conserving its last reserves of energy. As organ function declines, the body prioritizes only what is most essential. The heart no longer pumps blood as efficiently, circulation weakens, and oxygen supply to the muscles decreases. This is why in their final months, many elderly individuals feel increasingly weak, unsteady, and unable to maintain the activity levels they once enjoyed. Another key factor is a slowing metabolism. Normally, the body produces and uses energy to fuel movement, but in this stage, energy is redirected inward, away from physical activity toward essential survival functions. As a result, older adults may start sleeping more, needing frequent naps during the day, and struggling to stay awake for long periods. Some even experience sudden drops in energy. One moment they seem fine, and the next they are completely drained. Perhaps the most heartbreaking part of this process is its emotional toll. Many individuals who once took pride in their independence begin to feel frustrated or even ashamed that they can no longer do what they once could. They may withdraw from conversations, avoid social interactions, or abandon hobbies, not because they don't care, but simply because they don't have the energy. This can lead to a cycle of isolation, where they stop trying to engage, which in turn accelerates their decline. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be incredibly painful. It's easy to assume they are just being lazy or that they need to push through it, but the reality is that forcing activity will not help. Instead, what truly matters is understanding their limits, giving them space to rest when needed, and ensuring their remaining days are as comfortable as possible. If you notice a loved one experiencing deep, persistent fatigue that isn't relieved by rest, take it as a sign that their body is going through a major transition. This is the time to cherish conversations, create moments of peace, and offer support without expectation. Because in the end, what matters most is not how much they can do, but that they feel loved, understood, and at ease. If you've found these insights valuable, comment 1 below to let me know you're here. And if you haven't subscribed yet, hit the subscribe button and turn on notifications so you never miss a video. Your support allows us to continue bringing you content that informs and inspires. One of the earliest and most obvious signs that someone may be approaching the end of life is unintentional weight loss. At first, it may seem insignificant. Clothes are looser, a belt needs an extra notch, or a slightly diminished appetite. Many families consider it a normal part of aging, but the truth is, losing weight without trying is rarely a good sign. It often means that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. While the natural aging process does result in some muscle loss, Rapid or unexpected weight loss is a warning sign. This suggests that the body may be struggling to digest food properly or is losing the ability to process protein efficiently, leading to muscle atrophy. This loss of strength not only makes it harder to move around, it also increases the risk of falls, weakens the immune system, and makes a person more susceptible to infection. The link between weight loss and changes in appetite. Another major reason for weight loss in later life is a decrease in appetite. Many older adults no longer feel as hungry as they used to. Their sense of taste diminishes, food no longer excites them, and they may start skipping meals or eating much smaller portions. But this is not just a matter of preference, it is also a physiological change. As the body prepares for the final transition, it stops signaling the brain to seek food. This often coincides with a decrease in energy levels, a loss of strength, and a decline in overall health. In some cases, eating less is not a conscious choice, but the body simply stops asking for nourishment. The role of underlying medical conditions. Weight loss can also be a warning sign of underlying chronic conditions, such as cancer, heart failure, or kidney disease, many of which begin to progress long before other obvious symptoms appear. Even mental health conditions, such as depression or cognitive impairment, can reduce appetite, creating a dangerous spiral that deprives the body of the fuel it needs to sustain life. How families can respond. Concerned families often try to increase food intake, providing favorite meals, high-calorie snacks, or protein supplements. But if weight loss continues despite these efforts, it is important to recognize that this is not just a dietary issue, but a sign of a deeper transformation. At this stage, force-feeding will not work. Instead, the focus should shift to comfort and quality of life. Providing easy-to-eat foods, regular hydration, and ensuring meals are appetizing can make a much bigger difference than simply increasing calories. If you notice your loved one losing significant weight, eating less, feeling weaker, or having trouble staying active, take it seriously. It's not just about appearance, it's the body sending a message. Recognizing this message now will help you prepare for what's ahead with clarity, compassion, and the ability to make the most of every moment. As a person approaches the final stage of life, one of the most striking changes often appears in their thinking, communication, and engagement with others. Someone who was once sharp and energetic may suddenly struggle to follow conversations, forget familiar names, or seem disoriented even in well-known places. They might repeat themselves, lose track of time, or appear lost in thought more often than before. These subtle cognitive changes can begin months or even years before death, and they go beyond normal forgetfulness. Just like any other organ, the brain requires a constant supply of oxygen and nutrients to function properly. But as circulation weakens and oxygen flow to the brain decreases, mental clarity starts to fade. This decline doesn't always happen in a straight line. Some people experience brief moments of clarity, only to fall back into confusion just hours later, almost as if their mind is flickering in and out. Beyond memory issues, many elderly individuals also begin to withdraw from social interactions. You may notice that they talk less, engage less, and spend more time in silence. It's not because they've lost interest in their loved ones. It's because their brain no longer processes emotions and conversations in the same way. Even simple conversations can become exhausting, and noisy or crowded environments may feel overwhelming. Over time, many seniors retreat into their own world, choosing solitude over social connection. As cognitive function declines, emotional regulation also changes. Some individuals become more irritable, anxious, or easily frustrated, while others seem detached, indifferent, or unusually calm, almost as if nothing really matters anymore. These changes are not a shift in personality, but rather a reflection of the brain adapting to the body's decline. As emotions become harder to process, the person may stop reacting to situations the way they once did. For family members, this stage can be heartbreaking. Watching a loved one become confused, emotionally distant, or withdrawn can feel like losing them before they are actually gone. But it's important to remember this is not something they can control. Instead of trying to force them back into engagement, the best approach is to meet them where they are. Speak gently and offer reassurance. Create a calm, familiar, and peaceful environment, and accept that even if they don't always respond, they can still feel your presence. If you notice a loved one becoming more forgetful, confused, or emotionally distant, don't ignore it. These are often the mind's way of preparing for the body's final transition. This is the time to be patient, cherish the quiet moments, and focus on love rather than words. Because even when memories fade, the feeling of comfort and care remains. The fourth sign you may notice that your loved one is entering the final stages of death is a significant change in breathing patterns and circulation. You may notice that your loved one is breathing more slowly or shallowly than before, sometimes pausing between breaths, or breathing irregularly, breathing rapidly and then suddenly slowing down. Some individuals develop a special breathing pattern known as Cheyne-Stokes breathing, in which deep, rapid breaths are interspersed with long pauses. These changes may start out subtle but become more pronounced over time. Another obvious sign is poor circulation. Their hands, feet, ears, or even nose may start to feel cold to the touch, and their skin may look pale, bluish, or even slightly patchy, especially around the fingers and toes. This happens because the body is prioritizing blood flow to the vital organs, reducing circulation to the extremities, as the heart weakens and struggles to pump blood as efficiently as before. Difficulty breathing may also become more apparent, even with minimal activity. Simple movements such as sitting up, changing positions, or talking for long periods of time may cause them to feel short of breath. You may notice them breathing through their mouth more often or having to stop mid-sentence to catch their breath. If they were previously able to walk around the room easily, but now struggle with even the slightest effort, it could be a sign that their lung function is declining. In some cases, fluid buildup in the lungs can cause a persistent cough, wheezing, or a feeling of tightness in the chest. While this may seem like congestion from a minor illness, in older people who are nearing the end of their life, it often signals progressive deterioration of the lungs. Lying flat may become uncomfortable, leading them to prefer to sleep on their backs or propped up on pillows to make breathing easier. For family members, witnessing these changes can be upsetting, even frightening. Your instinct may be to encourage deeper breathing or to panic when your breathing becomes irregular. However, in many cases, these changes are simply the body's natural way of slowing down. While medical interventions such as oxygen therapy or certain medications can help alleviate the condition, the main focus should be on providing comfort rather than trying to reverse the inevitable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. If you notice signs such as irregular breathing, cold extremities, or a bluish tint to your skin, these are signals that your body is conserving energy and your circulation is slowing. This is a time to provide reassurance, create a calm and peaceful atmosphere, and ensure that your loved one feels safe, cared for, and comfortable. During these final weeks or months, the most valuable thing you can provide is not aggressive medical treatment, but dignity, comfort, and the profound assurance that they are not alone. As the body begins to weaken, one of the most evident physical signs is a declining immune system. You may notice that a person who once rarely fell ill now seems to catch every cold, flu, or minor infection. Common illnesses that used to pass quickly now linger, and simple injuries like small cuts or bruises take significantly longer to heal. These changes are not random. They indicate that the body is losing its ability to heal and protect itself as efficiently as before. One of the biggest concerns is the increased risk of recurrent infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even mouth infections become more common as the immune system weakens. Many families assume these are isolated illnesses, but when they occur frequently or take longer to resolve, it is often a sign that the body is struggling to fight off even minor health threats. Even antibiotics, which were once effective, may no longer work as quickly, requiring stronger medication, longer recovery times, or repeated treatments for previously minor infections. Another overlooked issue is chronic wounds. If small cuts, sores, or bruises are slow to heal or keep reappearing, it could indicate compromised circulation. Poor blood flow means that oxygen and nutrients are not reaching the skin and tissues effectively, making the healing process much slower. For those who are less mobile, pressure sores become a serious risk, potentially leading to dangerous infections if not managed properly. What is even more concerning is that infections in the elderly often do not present the way we expect. Instead of a high fever, An older person may simply appear more fatigued, confused, or uninterested in eating. In fact, a sudden decline in mental alertness is often one of the earliest warning signs of an infection, even before other physical symptoms emerge. Recognizing these changes early can make a significant difference in ensuring a person receives the right level of comfort and care in their final months. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. The instinct may be to push for aggressive treatments, hoping another round of antibiotics or another hospital visit will make a difference. But at a certain point, the focus often shifts from seeking a cure to prioritizing comfort. Ensuring proper hydration, keeping the skin clean and moisturized, and minimizing physical stress can be more beneficial than another round of medication that may only prolong discomfort. In the final stages of life, providing warmth, care, and dignity can matter far more than any medical intervention. Final thoughts. As we come to the end of this video, take a moment to reflect on what we have discussed. Extreme fatigue, significant weight loss, cognitive decline and withdrawal, major changes in breathing and circulation, and frequent infections with slow healing. These 5 signs often emerge in the final months or year of a person's life. They may not appear all at once, and at first they might seem like natural parts of aging. However, when they become persistent and noticeable, they are often indicators that the body is preparing for its final transition. For many families, recognizing these changes can be difficult. The instinct is to encourage loved ones to eat more, move more, or fight against exhaustion. But rather than trying to push against the inevitable, the most compassionate thing we can do is to listen to what their body is telling us. Instead of focusing on reversing these signs, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. These changes should not be feared but understood. By noticing them early, families can provide better care, make important decisions in advance, and ensure that their loved ones' final moments are filled with love and dignity. This is a time to cherish quiet moments, share memories, and remind them that they are valued and not alone. If you are seeing these signs in someone close to you, take a deep breath and remember, you are not alone on this journey. Many families have walked this path before, and while it is never easy, having awareness can bring strength, patience, and peace. Thank you for joining us today. We would love to hear your thoughts. Comment below with one thing you've learned from this video and how you plan to use it in your life. Your insights mean a lot to us, and reading your comments gives us encouragement to continue creating valuable content. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue informing and inspiring others. Thank you for watching, and we look forward to seeing you in the next video.